I've been walking with my face turned to the sun, weight on my shoulders, a bullet in my gun. Oh, I got eyes in the back of my head, just in case I have to run. I do what I can when I can, while I can for my people. While the clouds roll back and the stars fill the night, that's when I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. Can you hear freedom calling, calling me to answer? Gonna keep on keeping on. I can feel it in my bones. Early in the morning, before the sun begins to shine, we're gonna start moving towards that separating line. I'm wading through muddy waters. You know I got a made up mind, and I don't mind if I lose any blood on the way to salvation. And I fight with the strength that I got until I die. So I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. Can you hear freedom calling, calling me to answer? Gonna keep on keeping on. And I know what's around the bend might be hard to face, 'cause I'm alone, and I just might fail, but Lord knows I'll try. Just as fill up the sky. Stand up, take my people with me. Together we are going to a brand new home, far across the river. Can you hear freedom calling, calling me to answer? Gonna keep on keeping on. I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. Do you hear freedom calling, calling me to answer? Gonna keep on keeping on. I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. I hear freedom calling, calling me to answer. Gonna keep on keeping on. I can feel it in my bones. I go to prepare a place for you. I go to prepare a place for you. I go to prepare a place for you. I go.
All right. What a lovely day for a Black History Month program. I wish you a good afternoon. Thank you so much to our wonderful artists, Meryl Pusey and Coley Gladney. What a lovely display of your art. Thank you so much for what you have brought to our community during Black History Month. We'll be showing that throughout our History Month programs. We are settling down to our third Black History Month of the month, our program of the month, and we look forward to next week as well. All programs are being posted on our YouTube channel. We invite all of you, if you missed any of them, you'll want to go back and see them. We also have a survey at the end of this program that we really would implore you to please fill out so that we can begin to develop data and feedback that will help to improve our programs. So we are so happy now that you have taken this time to join us for our Black History Month program at Evergreen State College, Tacoma. And I would like to turn this over to our illustrious faculty lead, Dr. Ming-Shao Lee.
Many of you has taken my class before, but some of you are guests and never see how beautiful and how informative Evergreen Tacoma's curriculums are. So, and our glorious history as represented by today's speaker, Leah Ford. I'm going to do a brief introduction of Leah Ford. First of all, Leah Ford, for me, it's like my daughter. Even though we never, I never told her I think she's my daughter, but that's how I feel about Leah Ford, because she was my student for a couple of years, and Leah Ford now is a mother of two, received her undergraduate from Evergreen State College, Tacoma, with an emphasis in social justice and public health, graduating in 2018, and currently she's working towards her Master of Education at Eastern Washington University. And Leah Ford is a health promotion coordinator for Tacoma Pierce County Health Department, and will be presenting at this year's American Public Health Association Annual Expo. The annual expo and meeting is the largest of the most influential yearly gathering of public health professionals, bringing public health communities together to experience robust scientific programming, networking, social events, and poster sessions, and more. So Leah Ford will be part of that as a professional working in health, public health. She's also a board member of the Tacoma Women of Color Collective, and is a member of the Pierce County Community Engagement Task Force. She's a leader in women's health, and a member and Washington State Maternal Mobility. We are going to be delighted by her knowledge, on-the-ground knowledge in the Pierce County Health Department's handling of the COVID-19 crisis. And her organization supports the Black Infant Health Program with the goal of improving African American Black infant maternal health, as well as decrease health inequities and social inequities. Without further ado, and I give you Leah Ford. She's part of a human milk work group, aiding hospitals, birth centers, clinicians, and employers who want to support breastfeeding and nursing at their community.
I'm just so happy to be
She
here with you all
collaborates
today.
with local and state
I'm also here with a coworker of mine. Her name is Kalima Love. She's a public health nurse that also supports the Black Infant Health Team, and also is activated for some COVID-19 activation response. And initially, Talima was going to just help with some technical support because that's just kind of how we tag team presentations, but she's so dope and so awesome, and I wanted to share her with you all. So Talima, do you want to introduce yourself?
Advocates.
Hello,
it is
everyone.
A basic human
Again, my
right
name is
to,
Talima Love, and I'm so privileged to be able to work with Leah around Black Infant Health specifically. We have both been activated for different roles in our, she as a part of the racism response, as well as the COVID response, and I've done a lot of work with her in that regard. She is awesome, as Professor Lee described, so it's really cool that she comes from Evergreen. I myself am an SU alumni, Seattle University, who also has a huge social justice aspect to education there, graduate of 08. I've been in nursing since that time, did some time with labor and delivery in the hospital system, felt like I could be more impactful in the community, and that's how I ended up doing public health at our Tacoma Pierce County Health Department. So that's me, and just here to support and cheer on Leah in this presentation.
And in her free
Thank
time,
you so much
she
for
enjoys
being here, and it's great to see some familiar
family,
faces and new faces. This is just so cool, and I'm so honored to be here.
As well.
We can, let's
without
jump
further
into
ado,
some slides. I'll do a presentation. We'll talk about some data, and then we can just go into some open dialogue
for that
about
fantastic
introduction. Oh my gosh, that made me blush. Thank you so much, and I'm just so happy to be here with you all today. I'm also here with a coworker of mine. Her name is Talima Love. She's a public health nurse that also supports the Black Infant Health team, and also is activated for some COVID-19 activation response. And initially, Talima was going to just help with some technical support because that's just kind of how we tag team presentations, but she's so dope and so awesome, and I wanted to share her with you all. So Talima, do you want to introduce yourself?
Hello, everyone. Again, my name is Talima Love, and I'm so privileged to be able to work with Leah around Black Infant Health specifically. We have both been activated for different roles in our, she as a part of the racism response, as well as the COVID response, and I've done a lot of work with her in that regard. She is awesome, as Professor Lee described, so it's really cool that she comes from Evergreen. I myself am an SU alumni, Seattle University, who also has a huge social justice aspect to education there, graduate of 08. I've been in nursing since that time, did some time with labor and delivery in the hospital system, felt like I could be more impactful in the community, and that's how I ended up doing public health at our Tacoma Pierce County Health Department.
Any that aren't
So
answered
that's
or that
me,
we don't get
and
to or
just here
don't
to
have an
support
answer
and cheer
to,
on Leah.
I'll follow up and make sure you have an answer. And then we'll also use your questions to update
Thank you so much for being
the frequently
here,
asked
and
questions
it's great
list
to see
on our
some
website.
familiar
So,
faces and new
new
faces.
faces. This is just so cool, and I'm so honored to be here.
Things out, or
We can, let's jump into some slides. I'll do a presentation. We'll talk about some data, and then we can just go into some open dialogue about some things. So let me quickly, I just want you all to take a few seconds to reflect on this question. At this moment, how likely are you to receive the COVID-19 vaccine when it becomes available to you?
So
And you don't have to share your answer with us, but feel free to make note of it. And we're gonna shoot out a survey after definitely this, any questions you have, whatever comes to mind,
and if you have
concerns, anything that you're thinking about in regards to COVID-19
we would
and or the virus.
appreciate you
And
sharing.
thank you in
your
advance
feedback with us.
for
We really
sharing.
appreciate it.
So before we get to the nitty gritty, I first want to hear about the questions and concerns that you have about COVID-19 and the COVID-19 vaccine. We're going to capture these. We're going to share them with the team at the health department. And Talima and I are going to do our best to answer your questions as we move through this presentation, as well as after. Any that aren't answered or that we don't say them out loud, or if you could put it in the chat, I'll follow up and make sure you have an answer. And then we'll also use your questions to update the frequently asked questions list on our webpage. So I don't know if we would want to open it up. Have
I can read them out loud. You want them to be read out loud?
Or yeah, just so everyone kind of hears what folks are
The questions, 2 questions so far. When the next phase goes to open? And do we have enough vaccine for everyone?
Cool, and we'll definitely talk about that.
There's also a question, should pregnant nursing moms get the vaccine?
Excellent, we definitely will address that.
One more question, how can I get notification about availability? Yes, well, and we'll put a link in the chat, but the best way to get notified of vaccine events in Pierce County is to sign up at tpchd.org to receive alerts about community vaccine clinics, as well as alerts about mass vaccine clinics that are being put on in our area. You can also use Face Finder, which is an eligibility tool. I believe that Leah is going to speak to that in this. And in that process, once it declares that you're eligible, they will give you options for scheduling as well. There isn't like one central system yet where you can find out what vaccine is in the county at any given moment, but the best bet is to sign up at our website to receive those notifications.
All right, so we went over questions. Thank you all for sharing those out. So I want to first acknowledge that COVID-19 is not having the same effect on all communities. Communities that currently and historically experience marginalization are experiencing a greater burden of disease than their counterparts. And there's definitely distrust in healthcare services due to a long history in the United States of racism, inferior treatment, discrimination, and mistreatment of Black people and other people of color by the healthcare system. And these harms include the Tuskegee syphilis trials, nuclear testing in the Marshall Islands, and the repetitive, persistent experiences of discrimination that many experience when they visit their healthcare provider. And we are aware that some people may be concerned about the lack of diversity in clinical COVID-19 trials, and some wonder if early vaccination, even though it's approved, is another example of experimentation on vulnerable communities. I listened to a presentation yesterday, and the presenter, Dr. Ben Danielson, shared that he thinks about how we talk about vaccine hesitancy in our communities right now, and the conversation, which seems so much about like how do we educate the Black community to trust the vaccine more, when that's really not the right question at all. The question should be, how do we make sure our healthcare system is more trustworthy to the Black community? Because the Black community is not lacking in any education. They know and remember the deep, sophisticated knowledge and memory of harms done in the past, the far past, and the more recent past, and Flint, the even more recent past, and events all around us. And those are the lessons that are learned in health by a smart community that understands that it's hard to trust, especially when it comes to an infectious disease like syphilis, like corona, without having a trustworthy system to rely on. So I know there are questions and concerns about the safety and effectiveness of the COVID-19 vaccine, and we'll do our best to address these today. And we're definitely committed to science, and will only promote a vaccine that has proven to be safe and effective across all groups. So oftentimes we dismiss the flu as if it was a very mild illness, but in reality, each year between 29,000 to 650,000 people die from flu worldwide. In Pierce County last year, 13 people died of the flu, and the year before that, it was 42. And if you have the flu or cold symptoms and you test negative for COVID, you'll need to stay home and away from others for 24 hours after your fever resolves without the use of fever-reducing medications and your symptoms improve. And on our website, we have awesome infographics like the one you see on the slide and tons of more information. I just want to take a moment to talk about the difference and similarities between COVID-19 and the flu. COVID-19 is caused by the 2019 coronavirus, also known as SARS-CoV-2, and flu is caused by any of several different types and strains of influenza viruses. We've also seen some mutations with the COVID-19 virus, and different strains circulate each year. Similar groups of people, those who are older, have underlying health conditions, or are already experiencing inequities, are at a higher risk of worse outcomes. So both the flu and COVID-19 spread in similar ways. So coughs, talking, sneezing, what we call respiratory droplets that travel from a sick person and infect other people nearby through inhalation. People can also touch a surface with the virus on it and then transfer the germ to themselves by touching their face. And symptoms are super similar. The biggest difference is that COVID comes on gradually and the flu has a quick onset. And people with COVID may notice a loss of taste or smell. Also, more people with COVID have no symptoms at all. People infected with the coronavirus or the flu may not realize they're sick for several days, and during that time can unknowingly spread the disease to others. So we do have tests available that can differentiate between the two. There are antiviral medications for COVID, and most of those treatments show effectiveness to shorten the duration and severity of symptoms for those who are ill, but they're only available through an IV. So they're not prescribed to patients outside of a hospital setting. Treatment otherwise just focuses on reducing the severity of symptoms. Flu antivirals are widely available and can be given by mouth, and you can get them in and out of the hospital. And basic prevention practices are the same for both illnesses. The biggest difference being that there is a flu vaccine, and obviously we have a coronavirus vaccine now, but we're still, rolling that out. So we'll discuss more about the flu vaccine later, but both illnesses have short and long-term consequences, including long-term organ death and possible death. And COVID's death rate is 15 to 30 times greater than that of the flu. So now let's get into some data, graphs, statistics. Ooh, where's Dr. McCurry and Dr. Smith at? No need to get nervous. There's definitely so much value in numbers, and I could say for myself, I'm super grateful for Evergreen to shift my perception of math. I definitely hated it and wanted nothing to do with it, but now I just value the importance. And looking at this horizontal bar graph here, where N is referring to the sample size, our number of participants in Pierce County from March 1st to December 2nd of 2020 that were looked at. COVID-19 rates vary from about 1,500 cases per 100,000 in the group with the highest median household income to 2,300 per 100,000 in the group with the lowest. So in other words, COVID-19 disease risk is higher for people who make less money. COVID-19 rates vary from approximately 1,400 cases per 100,000 in the group with the highest percentage of those who have attended college to 2,300 per 100,000 in the group with the lowest, meaning COVID-19 disease risk is higher for people with a lower level of education completion. COVID-19 rates vary from approximately 1,500 cases per 100,000 in the group with the highest level of English speaking ability to 2,500 per 100,000 in the group with the lowest. In other words, COVID-19 disease risk is higher for people with limited ability to speak English. COVID-19 rates vary from approximately 2,400 cases per 100,000 in the group with the highest percentage of residents who are persons of color to 1,200 per 100,000 in the group with the lowest, which means COVID-19 disease risk is higher for people of color. COVID-19 rates vary from approximately 2,400 cases per 100,000 in the group with the highest percentage of residents in poverty to 1,400 per 100,000 in the group with the lowest. COVID-19 disease risk is higher for people who make less money. Adverse social, economic, and environmental conditions reduce our ability to stay healthy, and people living with less power and opportunity are more susceptible to disease and other negative health outcomes. At the health department, we applied our health equity assessment framework and found evidence that the direct and indirect effects of the COVID-19 pandemic have led to greater health inequity in Pierce County. Now let's dig into the vaccine. The COVID-19 vaccine is Black History. It's obviously February is Black History Month. I just want to call that out. Dr. Kizzmekia Corbett is an African-American woman who's the key scientist behind the COVID-19 vaccine. And I'm sure she'll become a part of history as a critical component in the development of science that will hopefully end this pandemic. She graduated from UNC with her PhD in microbiology and immunology and is the scientific lead for the coronavirus vaccine project at the National Institute of Allergy and Infectious Diseases, National Institute of Health Clinical Center. She worked with Moderna, the pharmaceutical company that developed one of the two mRNA vaccines that have shown to be more than 94% effective, And I just found it important to call out because if not now, then when? Let's be real. And it's just something folks may not know about based on where they receive their information. And I know there's mistrust regarding the vaccine. However, there's a Black woman leading the way regarding this vaccine. So I hope that's reassuring for some. So when will we get it? everyone wants to know, and there's a limited supply right now of the vaccine. And actually, due to weather conditions across the United States, we actually had a clinic, a community vaccine clinic that we were doing this weekend that we had to reschedule because the shipment's not arriving. So we're even at more limited supply. Vaccine distribution will adjust over time as the number of available doses increases, moving from limited to a broader populations in a phased approach. And the State Department of Health has released an app that you can use to determine when you'll be eligible to receive vaccine and where to get it. It's called Phase Finder. And as of today, Phase Finder is available in 29 new languages, which is awesome. And then for folks with who are blind or have low vision, there's some access available there as well, which is really great to hear. And the groups that are currently eligible to receive vaccine are those identified in Phase 1A. So workers in healthcare settings that can't work remotely, high-risk first responders, long-term care residents, and staff. Phase 1B are also eligible now to receive the vaccine. So 65 or older, or anyone 50 years and older who live in multi-generational households. And that is not, or households, excuse me. And that does not include someone, say, who's 50 years and has like kiddos. It's that your kids don't count to qualify for Phase 1B Tier 1. And the remaining tiers in Phase 1B are the next to receive the vaccine. And these phases were broken into 4 tiers to give guidance to vaccine providers on who to prioritize available vaccine to. And so we'll share some information with additional breakdowns of all the phases of the tiers. And vaccines are super important because they're training sessions for your immune system. You know, they teach the immune system to look for the key features of a virus. So when a virus does show up, it's ready to fight it off. And when you get a vaccine, your immune system makes antibodies to those fighter cells that stay in your blood and protect you in case you're infected with the virus. And you get protection against the disease without having to get sick. And when enough people in community can fight off the virus, it has nowhere to go. So that's where you've probably heard the term herd immunity or community immunity. And this means we can stop the spread quicker and hopefully get a little closer to ending this pandemic. Vaccines are one of the greatest success stories in public health, and they have successfully eradicated polio and smallpox. There are a number of vaccines under development currently. 37 are in testing safety and dosage. 28 are in expanded safety trials, 20 in large-scale efficacy tests, and then there's 6 that are approved for early limited use and 4 for full use. There's more than 70 different COVID-19 vaccines that are in testing right now, and looks like Johnson & Johnson is coming up, but currently we are using 2. We have Pfizer and Moderna, each require 2 doses. Each have shown over 94% efficacy across age, gender, race, and ethnicity. And all but one of the COVID-19 vaccines that are currently in Phase 3 clinical trials in the US use 2 shots. So we'll know more about each vaccine as studies conclude and make sure we share that out. We definitely don't expect 100% of all COVID-19 vaccine candidates to come to market. And in the links and resources that we share, I encourage you to check out this video, how COVID-19 vaccines are made. The video describes Operation Warp Speed, which is the federal program that funds and authorizes the production of vaccine while it's being tested. So let's talk about safety. I know that's a very pressing question. Studies of Pfizer and Moderna vaccines show that they're equally safe across race and ethnicity, as well as age and gender, as I just mentioned. Vaccine manufacturers intentionally recruited participants representative of the US population. And this helped assess safety and effectiveness across all different racial and ethnic groups. This diagram here shows how vaccines are developed. And this is the development process for all vaccines, including those that have been around for decades. So before they are approved for public use, they undergo a robust system of review by career scientists and independent experts to ensure safety and efficacy at every stage. So the orange to yellow bars are preclinical research and vaccine development. Before a vaccine can enter a clinical trial, scientists conduct studies to determine if they possibly have a vaccine candidate that could be safe and effective to solve a medical problem. The green bars are phases 1 through 3, which are the clinical trials, and an independent review board monitors vaccine trials during this phase to closely, ensure safety and efficacy. Any adverse effects would halt development at this stage. The blue bars show vaccine review and approval. So after Phase 3, the vaccine researchers submit their findings to the Food and Drug Administration, or the FDA, for review. And if the FDA approves, then the advisory committee on immunization practices will then review the evidence and give input to the FDA and the CDC on how the vaccine can be safely used. And then that purple bar there is phase 4. This is when vaccine is administered to the public, and then careful continuous safety monitoring occurs. Also, any volunteer participants from phase 3 continue to be monitored during this phase as well. In Washington, we have some extra precautions. Once the FDA grants emergency use and makes recommendations on how the vaccine can be used for the public, we have some extra layers of protection in Washington to protect residents here. The Western States Pact Scientific Safety Review Work Group is a body of independent, nationally recognized scientists with expertise in immunizations and public health. And they independently review the research. And our state also has a vaccine advisory committee and a vaccine science advisory group. And these groups also review the vaccine science and guidance and then provide input on the use of vaccine in Washington. Only after these bodies approve guidance and research will it be administered in our state. And this happens with, all the vaccines that are administered and that folks are receiving. And any vaccines you receive, that information is stored in our statewide immunization information database. So side effects are common. Honestly, they mean that the vaccine is working, and experiencing these effects don't mean you have the virus. You cannot get the virus from the vaccine. Rather, your body is starting to mount an immune response to the virus. And so it's possible you can experience injection site pain, redness or swelling, tiredness, headache, muscle pains, chills, joint pain, fever, nausea, swelling of your lymph nodes. Is that worse than having COVID? No, I'm just joking. It's not worse. But vaccination cannot give you COVID, and you will not test positive for COVID after you've been vaccinated, unless you were exposed to COVID before your body was fully immune. It typically takes a few weeks for the body to build immunity after vaccination. And that means it's possible a person could be infected with the virus that causes COVID just before or just after vaccination and get sick. So this is just because the vaccine has not had enough time to provide protection. Side effects from vaccination are different from COVID symptoms. If you experience any COVID-like symptoms, make sure you seek testing. Severe adverse reactions or harmful undesired reactions are rare, less than 1%. So if you have an unpleasant reaction to vaccine, report it to your healthcare provider. They will report it to the Vaccine Adverse Event Reporting System, which is a national safety monitoring system. If you experience any life-threatening emergencies, please call 911. And when you're vaccinated, you'll also be encouraged to participate in Be Safe, which is a text message system through the CDC that helps monitor reactions post-vaccination. The Pfizer and Moderna vaccines were not evaluated to determine if they're effective against asymptomatic transmission, and we just don't know yet how long protection lasts after vaccination. So even after you get vaccinated, we ask you continue with the other prevention measures you've been doing, such as washing your hands, wearing a mask, staying 6 feet apart, and limiting gatherings. Scientists estimate that to control COVID-19, about 7 or 8 of every 10 people will need to be immune. And it'll be important to use all COVID-19 transmission precautions until we know more about how many people get the vaccine and how long protection or immunity lasts. The vaccine is for anyone. People who have had COVID-19 can and should get vaccinated. The federal government will cover the cost of the vaccine. So the vaccine will be given at no cost. There should be no out-of-pocket cost to you, regardless of if you have insurance or not. Healthcare providers may charge for an administration fee, but either insurance or Health Resources and Services Administration will cover that cost. So you cannot be denied vaccination for any lack of insurance or any cost-related issue. Although there's no evidence that current illness reduces vaccine efficacy or increases the likelihood of an adverse event, if you are currently ill, you should wait to get vaccinated until you feel better and have finished your isolation period. People who've recently had COVID-19 should wait 90 days after illness passes before getting the vaccine, as data suggests it may be uncommon to get reinfected with COVID-19 in the 90 days after infection. And those who are recently exposed to COVID-19 should also wait to get the vaccine until after their quarantine period. If there is a high risk that you could infect others, you may be vaccinated during your quarantine period to prevent spreading the disease. And the Pfizer vaccine has been approved for people 16 and older. Moderna has been approved for people 18 and older. And we anticipate kiddos will be eligible for the vaccine when more is learned during phase 4 research. And the only people who should not get the vaccine are those who have had a severe allergic reaction to the specific vaccine or a component of the vaccine. And there's a list of vaccine components that you'll get at the time of your vaccination, and we'll make sure you have that information as well. There are certain groups that we strongly recommend speak to their healthcare providers before seeking vaccination, and those are folks who are pregnant, lactating, anyone who's immunocompromised, and anyone with a history of severe allergic reaction to another vaccine, and anyone with a bleeding disorder or someone taking a blood thinner. People who are pregnant, lactating, planning to become pregnant may choose to get the vaccine if they're currently eligible to receive vaccine as part of the current phase guidance. Pregnancy does increase the risk of severe COVID-19 illness. There's also possible increased risk for preterm labor. There is insufficient evidence to determine if the vaccine is safe for people who are pregnant, lactating, or the breastfed infant. So mRNA vaccines are not considered live vaccines and are not thought to be a risk to the breastfeeding infant. If you're pregnant, chest feeding, or breastfeeding, or planning to become pregnant, the American College of Obstetricians and Gynecologists strongly recommends you talk with your healthcare provider about whether or not the vaccine is right for you. And your decision can be based on your risk of exposure to COVID-19. Folks who are immunocompromised, meaning those with cancer, leukemia, HIV, AIDS, or other immune system problems, or taking medications that affects their immune system, may be at an increased risk for severe COVID-19. They may choose to be vaccinated, but be aware the vaccine might be less effective than for those who are not immunocompromised. For folks whose CD4 count is below 350, so that's severely immunocompromised, we do not recommend the vaccine. Those folks will not be able to develop immunity from the vaccine. And then anyone with a history of severe allergic reaction, meaning you had to go to the hospital or needed to be administered epinephrine. If history of severe allergic reaction to the actual vaccine or any of its components, you don't want to take it. But if it's just a normal allergy, typically there's an unknown, very small increased risk of an allergic reaction. And you are monitored after vaccination, and appropriate medical treatment must be available to manage allergic reactions. So you just want to make sure you tell your vaccinator that you have a history of allergic reactions, and they will monitor you. Anyone with a bleeding disorder or taking blood thinner, again, talk to a physician familiar with your health and your medications and ask if it's okay. And then neither the Pfizer or Moderna vaccine contain a preservative, and the vial stoppers are not made with natural rubber latex. So we may not have a COVID-19 vaccine yet available for everyone due to phase guidance and supply, but we do have a vaccine for flu. So we do recommend everyone over 6 months of age should get the flu shot every year. A flu shot can prevent, reduce severity, and shorten the duration of the flu, and it also increases community immunity, reduces hospitalizations and health system overload, and it prevents deaths. And as an important strategy to reduce COVID during flu season, we're asking folks to wait to get the flu vaccine if you suspect you have or have been exposed to COVID-19 to reduce exposure to healthcare workers. And the flu vaccine is covered by most insurance, it's free for kiddos, and it's available now. And again, we have tons of information on our website. So Dr. Lee mentioned the Equity Action Network. It is our community engagement strategy, and it's part of a larger effort to collaborate with community partners to reduce the disproportionate impacts of COVID-19 and address the underlying conditions that drive these disproportionate effects. The strategy has shaped the formation of the Equity Action Network, and the network aims to achieve these goals through strengthening and building cross-sector partnerships and relationships to really implement actions that influence like policy and promote equity, and just really center and amplify voices of community and the experiences and solutions of communities that are most impacted by inequities. And Taleema, I would love to invite you to participate in this county-wide network, and I'll make sure you have information on how to sign up. There's great newsletters, and we currently are sharing any registration information for vaccine clinics through partners in that network. And so if you're interested in learning more about that, it's definitely something that's great to get looped into. And that's all I got. If you want more information, definitely check out our website. We have tons of stuff on our website. There's my email address, there's Talima's. And yeah, I actually, before we get into some dialogue, I just want to share with you really quickly some real-time data. You know, at Evergreen, we talk so much about knowledge as a form of power and having accurate and real-time information for decision-making, and it really gives us power. I want to make sure you all have the same tools that we do as public health employees. And so so this is the CDC website once it pops up. Here you can see tons of information. It talks about cases in the United States. So here where my mouse is at, you see there's 27,669,556 cases in the United States. Here you can see that cases over the last 30 days are in a slight decline. And then the number of vaccines administered is 57.7 million, for folks who have received the vaccine. And when you think about the impact of the virus, you can see here the number of deaths, 489,067. And at the health department, there's so much data that's used and to analyze and research so many things. And for our specific program, data kind of is a barrier at times. We struggle. It's not always about the numbers when it comes to our work, dealing with families and birth outcomes and that sort of thing. And so, as we work towards racial equity, we really advocate for storytelling. And so I don't want y'all to think, just about these long numbers, don't get nervous about it, but think about the stories, think about all the lives that are impacted by cases and by these deaths, and think about the 489,067 folks in the United States that have died, and those families that have been impacted. And I hope that informs, some of the decisions that you all make as we go through these tough times. And think about where you're wearing a mask or choosing to hang out with folks. And each number is someone's story, and a reflection of all of our lives and all of our actions. So here is the Department of Health website, very similar metrics. They do have some tabs here that obviously are still loading. Here we go, loading that go over some additional metrics. Again, play around. I won't take too much time here. And then this is the Tacoma-Pierce County Health Department website. I'll just quickly show you this and then wrap up. Basically, it breaks everything down. You can see we're in phase 2, talks about trends and all that jazz. If you continue to scroll down, you can see the map here that talks about geographic information, breaking down our county and where cases are higher or lower. Then if you scroll down to here, there's demographics. And so this is kind of interesting to me. You can see, sex assigned at birth among confirmed COVID cases. Let's click this here. So race and ethnicity. So looking at our Native Hawaiian and other Pacific Islanders, you can see that they make up 6% of cases. However, they are just 2% of Pierce County's population. Looking at Hispanics, 19% of cases and 11% of the population in Pierce County. And similar with Black, 12% of cases and just 7% of the Pierce County population. So you can definitely see the inequities there. So I'll stop sharing. I hope it was helpful, and I hope you'll use this to assist you in making, informed choices and informed decisions as you live your lives. The virus is alive, and by design, it's here to replicate, and it plans to, unless we do something about it with vaccines or, social distancing. And again, I'll make sure you all have a list of all these links. And yeah, thank you. So let's talk about, do you want to address some of the questions, or what do you guys want to do? I don't know how much time you have left, not too much time.
Let's read through some of the questions. There are quite a bit of them. So I'm just gonna go from the most recent and move upward. Are they developing a vaccine for children under 16? Shall I take that one?
Yeah, go ahead.
So they are actually doing some smaller studies for children under 16 and under 18 for the two current vaccines that are being administered to see what the effects are. They are recommended for these age groups because during the initial trials, these age groups were not included, just around ethics and those type of issues, as well as, and this will answer another question about pregnant women. there is just limited data in those age groups. And so now, as the vaccines that are on the market have opened to the public, we are still in phases of collecting data. These vaccines are under emergency use authorization, so we are still learning more. That's why that system that Leah referred to earlier, the VAERS system, is so important, so that we can see what the impact is. So as far as we know, it's not necessarily dangerous for these groups. We just don't have the research to say that it is safe and effective in these groups. And so we are just waiting for that to become available. What advice would you give a 51-year-old woman who works in person as an administrator in the medical industry, but is not ready for vaccination? So I will say, watch and learn. Leah's going to share some links. I think there is a resource page that has been shared with Dr. Lee that you guys have access to. So I would say keep pace of what's going on. Also, you need to weigh your vulnerabilities. Are there any risk factors that you have that would put you more prone to having a negative outcome if you do have COVID? Say, for instance, asthma. And in the meantime, while you're still debating on that, using the strategies that we know are effective in reducing the spread of COVID-19, even if you're vaccinated, we are still not sure exactly, okay, can you still be a carrier even if you don't become infected? Can you spread it to others? And so that's why it's still important to follow the mask wearing, the social distancing, small gatherings, the hand washing, those strategies as well. So that would be kind of the advice that I would give out to you in that regard. Let's see, what's the difference if in vaccines, if one is approved for 16 and up and the other 18 and up? I will just reference that those were the age groups specified in the trials. And so once they got approved for emergency use authorization, they could only administer to the age groups that they are trialed for it to be safe. So it's just limited data. That will be changing soon. There's work happening around vaccinating that age group, but they are the least, probably the least affected by COVID, have the least worst outcomes, so to speak. And so it just hasn't been prioritized, but that work is happening. And as it becomes available, we will make that available to you. Will there be a vaccine site to make accessible to marginalized populations that have transportation barriers? So yes, we are working on that. Actually, the vaccine clinic that Leah referenced that was initially scheduled for this weekend did offer transportation to certain area codes. I also found out that there is Medicaid eligible patients should be able to receive transportation through community brokers. And I'll have to look that link up, but I can share that with you as well. So we just need to be creative in how we're able to get people to appointments. But yes, there is we're working on expanding that to everyone. And then we are working on specific marginalized communities, a lot of BIPOC, elderly who don't have access. Like there's a focus within our community engagement group to create clinics and to accommodate. So that's definitely work that's going on. If you have ideas about sites or people qualify or having a hard time, Leah has included our information. Please connect with us so that we can make sure that we prioritize those individuals that qualify and that want to receive vaccine.
And I'll jump in really quickly as well, like knowing that we are wanting to meet community where community's at. So if you are affiliated with the organization, or like if Evergreen wanted to host a vaccine clinic, we're doing some kind of smaller like pop-up clinics that we're organizing with folks. And so definitely reach out to Tolima or I, and we can give you the information that we need to help with planning kind of these targeted vaccine clinic events that are not broadcasted to the public, that hopefully will meet the needs of some of those who are disproportionately impacted.
Awesome, thanks for that, Leah. What about people with pre-existing conditions? Are they in any priority group for vaccination, or are there risks for them taking the vaccine? I think Leah did a pretty good job of reviewing what we know about the safety and efficacy of the vaccines. So that part of the question will be answered. Yes, they are prioritized. I did put a link earlier in the chat that is an infographic of the phase rollouts in Washington State. Currently, we are in 1A, servicing 1A, and then phase 1B, tier 1. And goodness, soon, hopefully spring or summer, we'll be moving into 1B, tier 2 through tier 4. And that does speak primarily to high-risk critical workers, aggregate workers, grocery store workers, childcare workers, children under 16, or people 16 and over that have comorbidities or underlying medical conditions. And then also high-risk critical workers under the age of 50, and people who staff and volunteer congregate care facilities, groups, homes with people with disabilities, those type of things. So those are the phases coming up. Unfortunately, one of the questions in the chat was, when are we moving into the next phase? We don't have that specific date yet. The state has a goal of vaccinating more of the people over 65, since we know that that's a huge group that's been largely affected. So once they have hit a certain marker, they'll let us know as we transition into those other phases. There is some talk of rolling out phase 1B, tier 2 and tier 4 at the same time, because that will cover all teachers. There's also a question in the chat about teachers and returning to school and needing to be vaccinated. So there's a conversation that they may do it together. 1B tier 2 speaks to 50 and over, 1B tier 3 speaks to 50 and under. So it would allow anyone working in the school to be vaccinated under both those tiers. But again, more information forthcoming. In the meantime, schools are reopening, and the CDC has released guidance on how to do that. And there's research that says they can do that safely and effectively, even without the teachers being vaccinated. So that answers another question in there. Sorry.
Leah, I got one that says, are tribal entities in Pierce County getting this information? Do you know what's being communicated there?
I do know that there are some tribal leaders that are part of the Equity Action Network. And so, yes, they are receiving this information. The government has designated vaccine to tribal groups, certain tribal, so they are kind of managing their own vaccine distribution and connection with their folks. But yes, they are receiving the same information.
I know we're running out of time. We will capture the rest of these questions. We'll answer them all and then shoot it out and make sure you guys all have them. And we are just so appreciative for all of the questions. I know there's a lot to learn about and a lot just to navigate. So thank you.
Thank you, Leah. And thank you also. I'm sorry, your name is
Talima.
Talima, thank you so much, both of you. I love the way you demonstrated that partnership. No one does anything well alone. So thank you for demonstrating that. Perhaps we have 1 minute left and we can get a nice, strong give back on behalf of Evergreen to our alumni and her associate. Okay, there's Meryl Pusey, our celebrated artist. I think she has a give back for us. Please unmute.
I just want to say thank you so much, because I was apprehensive about this, because I like that you were transparent about everything. And I really appreciate that. And thank you for the work that y'all do. And yes, I am interested in getting my vaccine, the vaccine.
Indeed. Part of the trustworthiness that you spoke of, Leah, has to do with women like yourselves who are in position to make sure that you are assuring us and informing us fully. for a minute there, I was running out of breath for you. I said, this is a lot of information, but it was rich, and we are definitely smarter as a result. Maybe one more give back as we close out our Black History Month.
Hey, how y'all doing? This is Anthony Zaragoza calling in from the road. I want to thank you. I want to thank you so much, Leah Ford, for presenting all of that great information. So important for us to have. I want to congratulate Evergreen-Tacoma for this as a public service during Black History Month. I want to thank Dr. Lee for a wonderful introduction, and I want to thank you, Leah Ford, for all of the incredible information that you've shared and that your partner there has shared. Thank you all so much, and keep coming back to Evergreen-Tacoma. Sankofa strong. Thanks again.
Absolutely, and thank you, Dr. Z. Most of all, what an honor to know that COVID is being cured by an African-American woman. You brought that information. We could be only so proud to know that the strides that are being made in this country and around the world, we are at the table. So with that, we want to thank you so much for that informative presentation.